We've now reached the 2 o'clock hour, so we're going to go ahead and get started. Those of you coming in at this point to the room, we will ask you to go ahead and turn off your camera and mute your microphone, please. That's helpful to us. I want to welcome you today. I'm Sarah Hahn-Qualls. I am from the University of Colorado, Colorado Springs, where I direct the Gerontology Center, and I'm co-hosting this series with Jody Waterhouse from the CU Anschutz Multidisciplinary Center on Aging. We welcome you today and appreciate very much your attendance. We have several dates coming up, 2 more this fall. Next week, you'll have the chance to hear Dr. Sarah Gilleth talk about understanding and responding to depression in these unprecedented times. And on December 3rd, Dr. Drake will be presenting on substance abuse and aging. And then we'll have a series of 4 in the new year that start in January. And hopefully your registration for this series bumps you into receiving information about the whole series. You also should have, you will be getting a handout at the end of this presentation along with an evaluation form. And those evaluation forms are very important to us. They really help us have the feedback we need to design future programs. Every week on Wednesday, you will receive the login information if you registered for the session on Thursday. So watch for those in your inbox. We're really delighted that not only are the 2 universities collaborating on this, but we have community partners who have supported this initiative, Denver Public Library and Broomfield Senior Services. So Jody Waterhouse, would you like to pop in and say a word or 2 at this point of welcome?
Yes, thanks so much, Sarah, and just a big welcome to all of you. I know many of you have been participating in all 3 webinars, so thanks for hanging in there with us, and look forward to having you at the last 2 to finish out 2020. But hopefully you are taking away strategies and tips from each of these presentations that you can certainly use in your work in the community with working with older adults, and then also as older adults yourselves. So we really do hope that you're getting a lot out of these programs, and if you ever have any questions about any of the topics, please don't hesitate to reach out to either Sarah or myself. So love seeing all of you and enjoy today's program. Thank you very much.
Thanks, Jody. Now, during this program, we don't take questions live. We take them through the chat room. So if you can hover your cursor until you have a toolbar pop up that has the word chat in it, you open that and you can put questions into the chat room. And in the last few minutes of this presentation, I will be serving as an MC and share your questions with our speaker who will have a chance to address them. So use the chat room for that. I want to introduce my colleague and friend, Dr. Sherry Gibson, who received her PhD in clinical psychology with an emphasis in geropsychology from the University of Colorado, Colorado Springs. She is an instructor and a clinical supervisor for us in the psychology department at UCCS and a faculty affiliate with the UCCS Gerontology Center. Dr. Gibson serves on the editorial board of the Journal of Elder Abuse and Neglect, is a member of the research committee for the National Adult Protective Services Association, and is a member of the Pikes Peak Elder Abuse Coalition. In addition to being an, I would say, ardent advocate for elder justice, Dr. Gibson has a private psychotherapy practice and consultation practice, which includes provision of capacity evaluations, expert testimony, consultation, and training. So without further ado, I will turn it to her to address her topic today, which is compassion fatigue, helping ourselves to help others. So if anyone has come in while I've been doing this introduction, I would invite you to please go ahead and mute your microphone and turn off your camera. And now I'll turn it to Dr. Gibson.
Thank you so much, Dr. Qualls, and a big thank you also to Jody Waterhouse for hosting this amazing training opportunity for us to be able to share topics that we're passionate about, and hopefully for you all to learn something new or be reminded of things that maybe you've already learned in the past. So I'm sure that my sentiments are reflected amongst all of us, that I wish we were sitting in a large room together, sharing ideas and being able to have a dialogue about particularly this important topic that I've been presenting on for probably the last 8 years. But it's never been more important to bring this back up again, the idea of compassion fatigue, particularly in a time of COVID, where so many of us are giving a lot of ourselves during this time. Whether you're a paid caregiver or a family member, whether you're in a professional role as a caregiver or informal caregiver, I suspect that many of you can relate to this topic. So I want to just jump right in. And I want to also preface before I do that to say that some of the information that I'm sharing is geared to people who are in an informal caregiving role, such as a family member or a loved one caring for another loved one. And I'm also going to be talking about people who are in professional roles in the helping professions, because this certainly affects the way that we work. And so I think that this information can, I hope that you will be able to relate to it in your own certain situation, your unique situation. And I look forward to having some dialogue at the end with your questions that I hope I can answer. Okay. Caregiving is very technically demanding, particularly, and actually I don't think it really matters if you're an informal caregiver or you're in a helping profession. There's a lot of schedules that we have to make, the things that we have to put together. If we are in a professional role, there's the technical piece of our work is very demanding. But even if you're a family member caring for somebody, you're also putting things together. You're having to get appointments made and making sure that people are on certain schedules. So there's a lot that we do technically in our role as caregivers. But caregiving also places a lot of demand on our humanity. And during this time of COVID-19, this combination of isolation, mortality at numbers that we've never, ever seen in this country or across our globe, the levels of anxiety that come with facing this invisible assailant of COVID-19 on a daily basis, and then also the grief that comes with a global pandemic. And grief is a big topic. It could be actually loss attributed to death of a loved one, or it could be the loss that we're all experiencing of what used to be normal and what our new normal is. And so it becomes a perfect recipe for fatigue and burnout. So what I hope to address today to you is that we have to attend to ourselves in order to attend to others. And I gotta tell you, this is really hard to do. I'll just give you an example from today. I had called in a prescription to my physician a few weeks ago, and my physician's assistant who called me back said, well, he'll see you, or he'll call in the prescription, but he does need to see you for your annual physical. And my first response was like, oh, God, who's got time for that? And then I thought, well, I am not a really good example right now of what I'm trying to impart to all of you, which is we have to take care of ourselves. So this just happened to me today on my way to my physical exam, my annual exam, thinking, I don't have time for an exam right now. I've got so much work to do. And then reminding myself, this is the one thing I really have to do. I have to take care of myself. So I hope that sharing my experience maybe normalizes it for some of you out there. It can make us wonder if there's ever light at the end of the tunnel, especially with COVID-19. We just don't know when any of this is going to end. We start going back into when we start going back into our daily routines, we see the spike in cases, and then we have to go back indoors, and businesses have to go back to certain restrictions. And so it does make us feel at the end of the day, will there be light at the end of the tunnel? So I want to talk about the term compassion, because compassion is actually very different from sympathy and empathy. And I'll suspect that a lot of you on this call have heard of compassion fatigue, and if we were in a room together, I'd be asking you, how is compassion different from sympathy and empathy? Empathy is really the ability to see a person's world through their eyes and to be able to relate at a deeper level. It's a vulnerable choice to be empathic with a person. Sympathy, on the other hand, is just recognizing that somebody is hurting, but not really having that true desire to help. And compassion is about us actually taking that step to help somebody, to help relieve the suffering of another. Compassion then is that emotional response that when we perceive suffering, we have an authentic desire to help. And the word itself has been derived from Latin and Greek roots, patai and pathian, meaning to suffer, and the Latin root com, meaning with, so suffering with. And I've shown here some pictures depicting, I think, some of our more contemporary people that we know, very compassionate healers in our time, Gandhi and Mother Teresa. But compassion has been documented for eons in our own human history. In Christianity, we know the story of the Good Samaritan, and Confucius, who is the major teacher of the Golden Rule, do unto others as we'd have done unto ourselves. In Judaism, it's the 13 attributes of compassion. And in Buddhism, loving kindness and compassion is part of the practice. The Dalai Lama believed that individual experience of compassion radiates outward and increases humanity and harmony for all. In fact, Dalai Lama was quoted saying, compassion is a necessity, not a luxury, and without it, humanity cannot survive. And even Charles Darwin, in his writing of Descent of Man and Selection in Relation to Sex, believed that it wasn't necessarily the survival of the fittest, but survival of the kindest, and that communities which included the greatest number of sympathetic members would flourish best and rear the greatest number of offspring. So in essence, compassion is this feeling of sorrow and concern for another, coupled with the desire to alleviate that suffering. So it's I feel for you, which is sympathy, plus I understand you, which is empathy, and I want to help, which is compassion. Compassion fatigue first came into the empirical literature in the early 1990s, introduced by Joynson, and then was developed into a model of understanding how compassion fatigue develops over time by Figley. And Figley developed this model to really appreciate the process by which fatigue develops and how that happens for an individual. This model has been used to describe that pathway of symptoms across multiple care settings and among people in different care roles, particularly with nursing. But it's also been translated to all kinds of professional roles. And I think also maps on just as well to informal caregiving. So I want to show you briefly the model that Figley proposed in the 90s. This was actually published in 2001, and I'm sorry that the bottom part is cut off, but just follow it with me. On the left-hand side, you see on the very top, there's an exposure to suffering. On the very bottom, there's a genuine concern for the individual or the population that a person is serving. And we all come into a caregiving role, for the most part, with an ability to be empathic individuals. So when you combine these three components, they lead to an empathic response in our work. There's two other important aspects here, factors. On the top, you see detachment. So that is our ability to detach ourselves from the caregiver role. And then at the very bottom is our sense of satisfaction. And I'll talk a little bit more about how this plays out. But when those three are also then added to this mix, you have what Figley called residual compassion stress. And then two other factors are added into the mix. And at the top, you have prolonged exposure to suffering. So this means that as we are doing our caregiver role, as we're working in that field or with that population or with an individual, that we have a prolonged exposure. We are constantly in that work day in and day out. And then at the very bottom, you'll see traumatic memories. Now, this may come up if let's say you're working as a nurse and you work in a ER, emergency room, and you lose a patient, and maybe that triggers a prior trauma or a memory that you had of another patient that you lost. When all these things work together, it develops what we call compassion fatigue. But before that can happen, there's another very important factor that Figley added, and that's at the very top, and that's our other life stressors. Because if you're coming at this from a professional lens, there are other things going on in our lives, not just what we're doing as our work, but we may also be going home to a caregiving situation. We may have financial burdens, or we may have problems in our relationships. We may be grieving a recent loss. So all of those things that are outside of just our work selves also play a role here. And this can then develop into what has been termed compassion fatigue. I want to talk about both external and internal factors that impact or increase our risk for compassion fatigue. The work environment is simply kind of our own societal support in a professional role. And that includes public policy, the regulations that we have to follow. Is there social acceptance and activism within our organizations, within our agencies? And also part of our work environment is our actual work setting. Now this could be this couldn't be more important than where we are right now. A lot of people are working from their home. You see me in my home study right now. And so now work has been combined with home, and that has created another level of stress. Some people don't actually have a separate room that they can work in. They might actually be working at the dining room table, which now they're sharing with their children who are homeschooled. So our work setting is really important. The physical environment is important. Our employer's values or the culture of where we work is vital. The tasks that we are asked to do and the guidelines that we have to follow as personnel. And then finally, our management level, the hierarchy, the ways we communicate, and our colleagues can either be preventative or can be a risk factor for us developing compassion fatigue. There are some effects of these external factors, and it's been termed as the 6 futilities, if you will, to our work. One of the futilities is our perception of the suffering, what we tell ourselves about what we see or who we interact with. And that perception can set us up for compassion fatigue. It's also the demands of the care recipient. If you're in a professional role, how many clients are you seeing? How many patients are you serving? If you're a family caregiver, this may be the demands that are placed upon you because you're the only person in that role, and maybe you don't share those, or you're not able to delegate your duties to other people. Or it may be that the severity of the recipient's needs at the time and how much they do depend on you. There's also institutional demands, communication and treatment errors that occur in systems and healthcare systems. Feelings of inadequacy. This is really important too, because I don't know who all is on this call, but I can tell you that in working as a psychotherapist during COVID, it's a very isolating place to be. And there are days where I feel like I'm just kind of wondering if I am doing the right thing, if I'm doing the right job. And of course, my friend and colleague Sarah on the call will laugh at that comment because I'm always questioning, which probably makes us good therapists when we do question. But these feelings of inadequacy can kind of take us over in a way that's not helpful. There's also sometimes the sense that the care is not benefiting the care recipient, that no matter what we do, the suffering persists. This is especially challenging for many people. But there are also external or internal factors that have an impact here. Being an empathic person is kind of a gift and a curse, because to be highly empathic, that means that we're able to quickly and more readily understand people, but it can also challenge our equanimity. And embedded in that personality trait, if you will, of being highly empathic, there's other pieces of us that play a role here too. Our temperament. So temperament maybe meaning, how do I cope with stress? How do I cope with anxiety? What are my typical relational styles when I am really stressed or overwhelmed? Our family and social history plays a part here. Our ability to have personal boundaries in our caregiving role. So are we boundaryless, or are we very boundaried and more rigid in that? Unresolved personal trauma can play a role here. And I would say that having a trauma history doesn't mean that you can't be an effective caregiver, whether that's professional or informal. It means simply that if you haven't worked through trauma, or that you're struggling with it and it emerges for whatever reason, not having that resolved or not getting yourself taken care of can also have an impact and can lead to that development of compassion fatigue. And then finally, the overgeneralization, thinking that others' experiences are similar to ours. And what we know is that we can never fully understand another person's experience. Even if, let's say I've had cancer and I'm working with somebody who's also had cancer, I can't say that my experience is the same as that person, because we are so individualized and so unique in our perception, in our experience of that. And so sometimes when people start to erode towards that compassion fatigue or burnout, they start overgeneralizing, making broad statements that, well, they must be feeling this way because I felt that way too. I do want to make a distinction here between burnout and compassion fatigue, because these two, just like empathy and sympathy and compassion, are also very different. Burnout is this gradual erosion of a person's mental, physical, emotional state. And it involves working in a job that's been kind of emotionally demanding. People with burnout report feeling exhausted, mentally, physically drained. They have a depersonalization, feeling hardened or numbed to their work, and a lack of accomplishment or satisfaction in their work. It's kind of the thing that does some human services in, rather than the compassion factors. Burnout stems from that combination of external and internal factors that I talked about that are frustrating and not fulfilling one's personal aspirations or their values. Compassion fatigue, on the other hand, feels very similar to burnout, but it emerges very suddenly. So this is the type of situation where the person is really disconnected from the root of the problem, from what's causing them to feel this way, that they'll just walk into work one day and say, that's it, I'm leaving, I quit, I'm done. It's really there's an existential or spiritual effect that accompanies a compassion fatigue, with these feelings of overarching meaninglessness, worthlessness, hopelessness, a sense of isolation from people who are supporting them, and a hypervigilance of fear. These symptoms can be very disconnected from the real cause. I want to talk to you about the signs and symptoms of compassion fatigue for the individual. And you'll notice that you have some handouts that I hope that you will utilize. I've used these for myself. I've also used them with clients. You've got two different handouts that you'll want to take a look at. One is a life stress test, and the other one is the professional quality of life measure. And this will really look at symptoms that would map onto compassion fatigue, burnout, and vicarious trauma. So for compassion fatigue, at the individual level, these are some of the symptoms that often show up. Having difficulty with concentrating or a preoccupation with the work and a pure exhaustion. Some people have nightmares and flashbacks, overreactions or avoidance of certain stimuli, chronic physical ailments. So a lot of people hold this kind of stress in their stomach. So there's a lot of GI problems, or the persistent sinus infection can be kind of a red flag. Also an apathy or loss of pleasure in pleasant activities. Excessive negativity, blaming others, complaining a lot, pointing the finger. We also see compulsive or avoidant behaviors such as substance abuse, overspending, overeating, gambling. And then personal problems in our relationships, intimacy voids, or just a denial that there is a difficulty or problems. You've probably run across this when you've seen a person struggling and you ask them, hey, are you okay? And the person says, yeah, I'm fine, fine. And they just walk away. You usually know something's up, they're not fine. But it's just this denial. They don't want to talk about it, don't want to accept that something is going on, because quite frankly, for many of us in helping professions, to show that we're struggling can sometimes take a meaning of its own, that we're weak, that we can't handle the pressure. And I think that this can set us up for even worsening symptoms when we don't accept what's going on with us and then seek help. Now, at the institutional level, so at the agency level, we also see how those symptoms play out. High number of absenteeism or staff turnover, increased difficulty with completing tasks and assignments or not meeting deadlines, sometimes unprofessional outbursts of anger or just aggression on teams, instability or conflict within teams or staff in those relationships. There's a desire to break the company rules. Increased rigidity or inflexibility when there's change. And gosh, right now in the helping professions, it's just always a moving target. There's a lot of change right now. Excessive complaining, negativity towards the management, maybe skepticism or apathy towards the vision of the organization, the future of the organization, and an inability for staff to believe that improvement is possible. So these are symptoms that have a ripple effect that can create systemic problems when at the individual level it's not being treated or tended to. We are susceptible to this partly because of our biology. I'll just give you a brief summary of what our sympathetic nervous system and parasympathetic nervous system is. But it's really our body's response to danger or to stress. And it's that fight, flight, or freeze response that we have when we are faced with a crisis. The problem is that if we are reacting every day to a crisis, that becomes chronic for us and it can wilt us. It can erode us. And so what we have to do is we have to engage our parasympathetic nervous system. That restores our physiological equanimity and it helps keep us rooted, helps us tend to ourselves and to thrive. One of the best ways to do this, that's absolutely free and it's something we do all the time, is breathing. Deep breathing is one way to engage our parasympathetic nervous system that's quite effective. This couldn't be more critical in a time of COVID to remember this, that we are living in heightened states of anxiety and of uncertainty, this not knowing what our future is and having to make lots of decisions and assessing risk if you're a professional on this call, coupled with the chronicity of it. We have been in this state for a very long time. And sometimes we can have perceptions that there might be no end in sight, or it may feel that way on certain days. And so we have to do things to provide hope and meaning and create meaning in our lives. So how do we protect ourselves? Well, resilience is really the antidote to vicarious trauma, burnout, and compassion fatigue. So I'm going to spend the rest of the time talking about how you can build your skills to improve or increase your resilience. When I think about the term resilience, I think of a rubber band, because by definition, resilience is the ability of something to return to its original shape once it's been pulled, stretched, pressed, bent. But on a psychological alternative of that definition is it's also the ability to recover from or adjust easily to a misfortune or change. So we have to develop skills to stay well so that we can attend to all parts of our lives. No pressure. I'm going to be talking to you about some skills. But one of the things I want to say before I talk about that is that your job is nothing short of heroic, whatever role you are in as a caregiver. And that heroic work requires extra levels of self-awareness, self-discipline, self-care. I mean, have you ever noticed how heroes fall and they fall hard? Think about the heroes of your childhood. Batman, Superman, Wonder Woman. You know how they suddenly get weakened and taken advantage of by the most subtle personal vulnerabilities? Well, when you think about those people, you also have to think of yourself as a hero, and that it doesn't have to have a tragic fall or a ruin. But really the question is, how do you build your resistance to your kryptonite? The first thing we have to start with is self-awareness. Self-awareness requires us to be aware of what's going on physically and emotionally within ourselves. So thinking about being attuned to your body, your mind, your spirit, so that you know how you are being and presenting in any moment in order that you can take care of yourself and others simultaneously. And this can be very simple, to just stop and take inventory. What's happening in your body right now? You can do this with me. Are you feeling tension in your back and your shoulders? Do you have a headache? Or are you feeling pretty good today? Notice if you're holding on to anything. Notice how you are in relation to your surroundings. Did you shut your phone off so that you could fully be present? Or are you distracted while you're hearing me talk? Also, part of the self-awareness is the existential self-awareness. The nature of this pandemic has begged all the big questions from us about what is truth and justice and good and evil. You'll have to do some kind of practice here in order to process and cope with those things. You have to find a way to develop a language and a coping strategy to manage the amount of suffering, horror, tragedy, and to help find meaning in that. And whatever you believe or understand now, working as a caregiver constantly poses new experiences that will challenge you and your perceptions, your beliefs and understandings to continually grow. And they won't do too well if they're too rigid. So giving yourself space to really explore those deep things for yourself, whether that's through journaling or talking with another person. And I'm going to talk about talking in a few moments. Self-regulation is another important skill. It's something we should have all learned in junior high, but usually didn't. Self-regulation is not something a lot of us have been taught in life, and it's not highly valued in our culture, actually, because it's not very exciting. We love excitement, don't we? But self-regulation is very important in our work as caregivers, which offers excitement overload all the time. Self-regulation is about how to use your self-awareness to have more conscious control over your perceptions, your communication, and your behavior. It's about being keenly, consciously aware of your physical and emotional responses right in this moment and ongoing, so that you can manage how you're being and presenting to others, to take care of yourself now so that things don't haunt you so much later. This is something that, athletes, mental health professions learn, but not so much for the rest of our population. In fact, many of us have been taught to ignore, or it's virtuous to ignore or tune out of our bodies, our emotions, and our spirits. But this can be dangerous in our work as caregivers, and can greatly affect not only our own well-being, but our effectiveness with others. So we have to find a way to kind of pump our brakes. Knowing how to instantly assess and regulate your level of awareness and arousal is key to not only achieving your objectives as a caregiver, but also taking care of yourself and those you're serving. Self-care. Well, when I was in graduate school, gosh, 9 years ago, I couldn't stand this word self-care, because we were always asked, are you taking care of yourself? What are you doing for self-care? Well, it turns out that self-care is actually a pretty important thing, and that's probably why it was drilled into us all the time to be taking care of ourselves. But self-care of course, it's eating well, exercising, and sleeping. All of those are very important, but it needs to be in ways that are sustainable and reasonable and also enjoyable for you. So if a particular diet or exercise problem causes you more frustration, or it's just one more overconsumption of your time and effort, then you got to let it go and pick something else. Moderation tends to be a lot more successful and sustainable than going militant. You also need to have regular fun in your life. And you've got to have fun like your life depends on it, because it actually does. In this line of work, as caregivers, you need to get a life and you need to keep your life. So spending our working life, particularly in the face of COVID-19, it will sap the life out of us. So especially when, the media, we're constantly being barraged by the media and the bad news, we need to remember that there's more out there. And so we have to take time to enjoy things that are pleasant to us. You also need to talk, because talking actually does help, but it has to be with the right person. So I've listed this exercise for you, and I'm going to talk about talking with the right person in a moment. One of the things that I'll encourage you to do, and I've put it on a handout, so you don't have to do this now, but I hope you will take a moment. I want you to list one mini escape or diversion that worked to restore and renew you. And then list one thing that brings you joy. Ask yourself, when was the last time you did that thing? What gets in the way of you doing it more often? And what are your personal triggers indicating that it's time to recharge your battery? These are really important, I think, vital questions for us to ask ourselves. It helps us recalibrate and come back to what we know is true about us, what we know we enjoy, and trying to find the time to do that. Now, talking it out. Talking is really important. In fact, it's the most effective way of preventing and healing from compassion fatigue. But who you talk to is even more important. The person you talk to has to be someone who can really relate to your situation. And that may or may not be your spouse. In my situation, my spouse is an electrical engineer. And I got to tell you, about 5 minutes into what I want to talk about, he's already glassed over. He can't relate. He cares about me, loves me very much, but can't really relate to me. So I need to talk to somebody who can do that. I also need to be talking to somebody who can be present without interfering in my process. somebody who doesn't one up or switch to their story. And you've been with that person. You start in and say, oh my gosh, let me tell you about this horrible day I had. And immediately this person interrupts and says, oh, you have no idea. Let me tell you about my day. Well, now it's not about you sharing your story. Now you're taking care of another person. And finally, that person needs to be one who understands and honors your confidentiality. They have to know that you're going to be talking about some very important, difficult things, and they have to respect confidentiality. Now, if you don't have a person that meets those criteria, for those of you who are in a professional role, you can utilize your employee assistance program benefits. For those of you who are informal caregivers, I recommend you do find a good therapist or a spiritual advisor, somebody that you can relate to, that you can talk to, whether that's in a professional role or an informal role. Some final tips, and then we'll take some questions. You want to dig where the ground is soft. Avoid the trickiest areas of your life to fix, and pick the issues that can be easily visualized, that you can easily visualize changing or improving. One of the questions that I love to ask with my clients is, what is the smallest thing that you could do that would make the biggest difference right now? Smallest thing. So take that small thing and carry that forward if you can. You might want to take stock of what's on your plate. Make a list of all the demands on your time and your energy, and look at that list carefully and see what stands out. What types of tasks or jobs that you're doing contribute to the overflowing on your plate? And you might want to brainstorm that with a friend, because usually a person on the outside looking in can see things that we can't see because we're just too much in the weeds. You might also want to start up a self-care collection. Ask friends what they do for self-care. Start making your own list and sharing ideas. On the professional side, you might want to start a self-care practice with your colleagues. Maybe have a contest for best self-care idea of the week. Initiate 5 minutes of self-care at each staff meeting where someone's in charge of bringing new ideas to the group. Finding time every day for yourself so that you can rebalance your workload and maybe even delegate things not only at the office, but also at home. It's really important for those of us who are working to create a transition from work to home, which is really tricky right now since work is in my study and home is right outside that door. So we have to have some kind of transition. There are lots of different things. And if we were in a room together, we'd be brainstorming and sharing all of the ideas. But things that I've heard other people say over the years is that they'll go out the door, take a walk around the block, and then come back in and transition into home. Another thing that you might do is change your clothes. Unless you've been wearing the same yoga pants for the last 3 days, then maybe put on a different pair of yoga pants. Maybe listen to fun music, but find a way to transition, because remember, Figley's model, detachment was one of those factors. When we can't detach from our work, that sets us up. That sets us up for compassion fatigue. Some final thoughts with you. Self-awareness is key to appreciating your own reactions to stress. You want to view others also through a lens of curiosity. Because when you see symptoms, as I mentioned before, we often don't respond to those symptoms in others with compassion. We're often judgmental. And so if you see people acting a way that isn't in line with what you've known them to be, just be curious about that and ask them if they're okay. And then turn that care inward to yourself as well. Utilize some key resources to prevent compassion fatigue, or intervene when you notice those problems. Using those handouts that I've provided for you is really important. And I've provided some resources at the end of this talk where you can go and find more online that are free to you. So I want to thank you all for being here today. It feels like a whirlwind because I could talk on this subject for a very long time. But I want to open it up now for questions from Sarah as a facilitator.
Great, Sherry. One of the things that's been provocative provocative for your listeners is looking at your life stress test that you shared in the handout. And people are wondering, so here's some questions that have come from that. One of them is, so why are vacations listed as stressful on the life stress test? And how do these points get assigned? Things like moving seem like it's a lot more than 20 stress points.
That's a really good question for the people who developed the measure. But one of the things I didn't hear from you, Sarah, the first thing that you said was you cut out there and I didn't.
Why are vacations on a list of stressors?
Oh, wow. Well, sometimes for some people, vacationing is really stressful. And I guess it depends on, the vacation you're taking and with whom. I don't know. For myself, I've often said there's so much stress around leaving the office for a vacation that it makes me sometimes wonder if it's worth taking the vacation, or it's so stressful knowing all the work that awaits me when I come back from a vacation. And I think that that's where that's coming from to be on that list, is that for some people, taking a vacation from work is more stressful. Once they get there, they're fine, but the leading up to and coming back from. As far as the points are concerned, I don't know how the points were assigned by the developers of that test, but I've also questioned that myself when I've looked at it. I'm sure that there must be a statistical reason around that based on who they've surveyed in developing that particular measure, but I don't have an answer for you. I'm sorry.
One person noticed that caregiving is not on there, which is interesting.
Yes, that is interesting. And that test I'm trying to remember when that was developed. It can be found, and the supporting literature can be found on the compassionfatigueproject.org website that I've provided for you. So I do encourage the attendees to go there to look at some of the other things. But you're right, caregiving is not included.
So one person's wondering whether support groups are helpful.
I think support groups are very helpful. Support groups are helpful in a number of ways. One is that I think through the sharing of our stories, that can be a way of normalizing what feels very abnormal and unique to us, that we can have a shared experience with other people. Sometimes it can also just be helpful in hearing how other people are coping. We learn so much from each other. We're social beings by nature. And so when I can hear other ideas that people are doing, that helps me be better in my own process or think about things in a different way. The diversity of experiences can also get us out of our own unique siloed experience. So there's the validation that happens, there's the support that happens, and then the normalization of an experience that can happen. So yes, I really recommend support groups.
You talked, Sherry, about the idea of being less judgmental of our colleagues when we see them weary, and try to apply our own compassion to them. I think sometimes people they look at their colleagues and feel like there's an injustice happening, that they're working harder than somebody next to them, or they have more burden than somebody else. And does injustice add to compassion fatigue, and what should one do about it?
Right. So the injustice that one feels towards another colleague would lead to injustice. Yeah. I do believe that is the case, because one thing that, I'm reminded of a situation that I experienced in a healthcare setting. There was a social worker who had just started on our team, and we had a big team. And the social worker had just started. She'd only been with us for a couple of weeks. And on this care team, you always have one team member that, everybody, whenever they start speaking, people roll their eyes. There just happens on the care team. But on this particular day, that person, who happened to be the dietitian on the team, started talking. And this new social worker that had just been on our team literally when the dietitian started working, put her head down on the table. Now, there are 15 people on this care team sitting around, and they're now looking at the social worker, and they're thinking, what is going on here? Well, as the meeting came to a close, everybody's filing out, and I'm listening because as a psychologist on the team, we're kind of attuned to doing that. And I'm listening, I'm hearing people making comments about the social worker. Well, she certainly isn't fit for this job. She'll never last another week. I guess we better start looking for somebody else. And I thought, well, that's interesting. So I waited a little bit, and then I went to this woman's desk in her office, and I sat down and I said, you know, I couldn't help but notice what you did in the team meeting. Are you all right? And she broke out crying, and she said, no, I'm not okay. Last night, my son tried to end his life and is now in a psych hospital, and I don't know what to do. And she said, I just started this job, and I'm afraid I'm going to lose my job. Well, what I did with her is I said, can I advocate with you, and can we go talk to your supervisor and get you time off? This is a valuable lesson to me. If we don't ask the question, if we assume, we have to assume good intent of our colleagues. And if we're not being curious and asking the question, then we don't know. And then we do think there's an injustice. And injustice does lead to compassion fatigue, because guess what? If I have that frame with that social worker, then she may leave the place, she may leave her job, we may push her out because we see the injustice, which then does what? I have to now pick up the pieces. I now have a lot more work on my plate, and now the compassion stress is going to be even higher. So I think those two are very, I mean, just anecdotally from my own experience, but also seeing it over the years on care teams. I think when we have that frame of injustice, we really set ourselves up.
Mm, mm.
It was a really good learning point for me, and to really take the time to ask somebody if they're okay.
It sounds like what you're saying in a way is that fatigue, compassion fatigue, doesn't absolve you of the maybe responsibility or opportunity to still use compassion.
Exactly my point. Exactly my point.
So can you talk a little bit about sleep? People who get compassion fatigue sometimes experience themselves having nightmares or intrusions or difficulty going to sleep from
Yeah.
that. What do you recommend for that?
Well, I hope that whoever's asking those questions did get to attend the sleep seminar that was held, because it was really informative. But I do believe that when we're having flashbacks because of our work and it's interrupting our sleep, that's really a signal for us to talk to somebody. That's a signal for us because there's something that is bothering us so much that it's interfering with our sleep. And in those cases, talking it out and getting some professional help around that is really important, because now it's gotten to a point that your subconscious is working that out, that it's starting to plague these, corners of your mind that are not able to rest. And what we do need in order for our well-being, especially in these high stress times, is we need our sleep. It's vital right now. So if you're having those kinds of experiences, I really recommend that you talk to somebody professionally about it. Work out those themes, talk through self-care. This is a good indicator to you that you need to take care of yourself right now. Maybe you need to detach from the work a bit. Maybe you need to take a time off. Maybe you need to, if you're a family caregiver, you need to get somebody else to come in and help delegate some work. That's usually an indicator that you're not taking care of yourself.
So how do you know when it's compassion fatigue that you can address yourself or it's depression?
Oh, good question. Well, because compassion fatigue sometimes looks like depression. And I think that fatigue can lead to depression when it's not treated. If you are, some of the typical signs of depression, and you're gonna have a talk on depression, so I hope that you'll tune in for that. But if you're, trouble with sleep, obviously, if you're having bouts of crying, if you're having frequent nightmares, if you're feeling hopelessness, if you're, having thoughts that there's not going to be a better tomorrow. If those are the things that are really plaguing you, I suggest strongly that you make an appointment with your primary care physician. You partner with them to talk about what your options are. And it may not be just pharmacological, but it may be that your physician could get you an appointment with a therapist so that you could talk about those things, get a real assessment to understand what's going on there. Because certainly I think compassion fatigue can lead us down to a path of more serious problems such as depression or clinical anxiety even. So I think, calling your primary care physician, seeing a therapist if you can, that's where I would start.
So if this is the first introduction someone's had to the idea of compassion fatigue, what are the 2 takeaways that you would like them to walk away with as like the key things that give hope?
Mm. Well, the key thing here is that you have to find meaning and joy in your life. Caregiving and helping others is a very joyous activity. We all come into this profession because we have that ability, because we want to help people. When you start feeling resentment around your work, when you start feeling drudgery around your work, that should be your self-awareness moment. You have to have self-awareness. Don't ignore the signs in yourself. The other takeaway is that I really suggest that you go to compassionfatigue.org. They have an amazing amount of resources. They have videos that you can watch, and getting yourself educated more about compassion fatigue. When we're educated, when we have knowledge is power. Then we know we can do something about it. So don't sit in the chaos of what you're feeling. Get out there and do some research, do a little bit of reading, but also have some self-awareness and take time in your daily life to connect to that awareness. Do some writing, some journaling. One of the things that I do with some of my clients is have them keep a gratitude journal. Write down 3 things that you're thankful for at the end of each day. And once we can remind ourselves of the goodness in life, of the reasons that we come into this work, of the things that we enjoy in our work, we have to reconnect to that once again. I think that would be my takeaway.
That's excellent. Thank you so much, Sherry, for this wonderful presentation and really thoughtful suggestions for where to put our attention and how to take care of ourselves. So I'm going to call this to a close here at this point and just remind you, all of you attendees, that we're so grateful you joined us. And we're also so grateful that we can present this series with these experts that know so much and have such good experience in working with big challenges that are exceptional challenges right now during this difficult time. So next week, please tune back in for Dr. Gillif's presentation on understanding and responding to depression in unprecedented times. So thank you so much. Goodbye for today.
Thank you. Thanks, everybody.